Good day, students. I am Agbolade Owen. I want to teach you some aspects of applied parasitology in this video. In this video, we want to cover intestinal amoebiosis, human malaria, and then schistosomiasis. Human intestinal amoebiosis. Amoebiosis is also known as amoebiasis. That is amoebiasis and amoebiosis. The two terminologies refer to the same disease. It is caused by Entamoeba histolytica, a protozoan, which has two strains: the magna, which is virulent, minuta, which is avirulent, that is not pathogenic. The parasite is known to infect the small and large intestine of monkey and man, and it is worthy of note that it is the feeding stage, referred to as trophozoites, that is found in the intestine. Epidemiology: this infection, that is Entamoeba histolytica, is second to malaria as a protozoan cause of death worldwide. It has been estimated to infect up to 50 million people per year, causing 40 to 100,000 deaths annually. It is not to be found almost everywhere. That's meaning of cosmopolitan, but it is more frequent, more prevalent, occur more or mainly in the tropics and subtropics, in regions, in areas with poor sanitation and poor personal hygiene. So those two things, they go together: poor sanitation and poor personal hygiene. Transmission is essentially by ingestion means swallowing of infective cysts. This could be swallowed, when infected feces, that the feces having defective cysts are picked, or is on a finger. Maybe you use the toilet and you fail to do proper cleaning up and hand washing. That could be a way of infection or transmission. It could be at times through water, when such infective cysts get their way into water alongside feces or food. Vomites are droppings from the mouth part of insects. So there could be transmission through such things. Likewise, even the body of many insects, for example houseflies, which move from toilets to houses, and at times they perch on food and things like that. If you ever watched housefly, when they get to any surface, they try to do some kind of kind of ablution, clean their front, their first pair of legs, the third pair, as if they are trying to brush some things up. As they do that, anything that could be infected, that could cause infection, this time around, infective cyst of Entamoeba could be dropped on any exposed food or water through such infective cyst carrying flies. You will notice again, it is essentially transmitted, that is this infection, by ingestion of infected cyst. In addition, when vegetables are cultivated in or on or with feces contaminated soil or feces contaminated fertilizers, feces contaminated water, there could be infection eventually when such vegetables are consumed, let me say, carelessly. The other time I was talking about poor sanitation. Is very important. It enhances what we call transmission, alongside with overcrowding. When you have too many people, than needed, than necessary, inhabiting a room, for example, a house, that factor could enhance transmission, particularly when there is poor sanitary practice. It is also known that through oral and anal sexual practices among homosexuals, transmission is possible, though that is not all that common. Let's continue. Pathology and pathogenesis. It is known, like I said the other time, that one of the strains is harmless. That is the minuta. So when such a strain is in individuals, generally such will be more or less symptomless, and such people are referred to as symptomless carriers. However, the pathogenic one, the magna, could invade the intestinal epithelium, feeding on red cells, causing abscesses in the mucosa and submucosa. Abscesses are pockets, as it were, containing pus. The trophozoites at times may be carried by portal bloodstream to some tissues outside the intestine. That's why we say some extra intestinal tissues. And depending on where they are carried to, for example, when they are carried to the liver, they cause hepatic amoebiosis. When they are carried to the lungs, that will be pulmonary amoebiosis. When they are carried to the brain, they cause cerebral amoebiosis. And this when such organs are infected, they cause a formation of abscesses. Continue. How do you diagnose intestinal amoebiosis? Which is also known as amoebiasis. It could be diagnosed using microscopy and antigenic detection. The extraintestinal ones could be diagnosed using serology and imaging studies. Cysts occur in formed stools, whereas the trophozoites bound in fresh diarrheic stool, fresh watery stool. Cysts are never found in the tissue lesions. That is, when you pick fecal matter of either patients or examinations during a kind of study, when you examine these stools, at times they could be formed, and when they have this problem, infection with Entamoeba histolytica, all right, you may find cysts in formed stools. When the stool is diarrheic, that is fresh and somewhat watery, it may be many times, in fact, generally, it is the feeding stage that could be found. That is the trophozoite. Remember, cysts are not found in tissue tissues. Prevention and control. 1. Those who are food handlers that are infected, they are referred to as reservoirs of infection. You should understand, because they are infected, and if they are not properly treated, the infection could get to others easily, free of charge as it were. So it's better to have them treated, and then some people advocate that they should be excused from their work, has to be off. That's a bit difficult until they are proclaimed cured, free of the infection. The next point here is improved personal hygiene of individuals and food handlers. The next one, improved general level of sanitation, keeping our environment clean, very important. Supply of safe, potable, this is not portable, it is Potable, potable water. Potable here means safe for human use, safe for drinking. Supply of safe, potable water, not portable, by adequate purification. Apart from that, sedimentation and filtration of water could be done to remove the cyst of Entamoeba histolytica. The cyst could be killed by boiling and using iodine. Note that chlorination will not affect or destroy the cysts. Improved sewage disposal and provision of adequate functional toilets. Not just toilets. They should be adequate in terms of number, and then they should be functional. If it is water closet, there should be water to do flushing, to do washing, and the like. If it is pit latrine, there should be no blockage or people handling it carelessly, such a way that becomes a place where many people will not want to enter. All right, it should be kept clean and functional as it were. Avoidance of uncooked vegetables is another strategy. And if you have to eat uncooked one, they could be soaked in soaked in acetic acid or vinegar for 10 to 15 minutes before consumption. Maybe if you want to eat your vegetable salad, this one fresh, which is normally vegetables are best eaten fresh. So if you want that, you could have such vegetables soaked in acetic acid or vinegar. The main component of vinegar, which is of the relevant standard, is acetic acid. Soak the vegetables in the acetic acid or vinegar for 10 to 15 minutes, and then you are good to go. It's also important to avoid using unfermented human feces for the purpose, as agricultural fertilizer. Water supply should be protected from contamination, very important, and we have a long way to go in that regard, because you see many water pipes burst, seepage, and as water is coming out, no doubt some deities may be getting to such pipelines. God help us. Health education is very important to improve personal hygiene. The treatment of affected women with drugs, and some are listed here: flagyl, metronidazole, praziquantel, chloroquine. Organ abscesses at times may require a drainage, in case of those that have such cases. That is all I have to tell you concerning intestinal amoebiosis. The next thing I want to talk about is human malaria, the next topic. There are 4 important Plasmodium species that are pathogenic in man. These are the Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale. The 5th one here, Plasmodium knowlesi, is not to be found normally in monkeys, but in some ancient countries, it has been recorded to infect man at times, implying that Plasmodium knowlesi, which is normally found in monkeys, is zoonotic. When we say a parasite is zoonotic, it means that it could occur in man and animals. occur in man and animals. Human malaria is of public health importance. Why? It often affects, inflicts young children, mostly under the age of 5 years old, and the pregnant women in tropical and subtropical regions in the world. And it is leading parasitic disease afflicting man, resulting in serious morbidity, that has to do with disease, and mortality, death worldwide. According to WHO, the daily, which I was talking about in the first election, that the estimated for malaria, you have it here, 35.7 million. Pathogenesis, pathology, and clinical findings. The incubation period includes exoerythrocytic cycle, usually 2, and at least 1 or 2 erythrocytic cycles. Now, at this point, I need to tell you that you need to revise your life cycle of Plasmodium. Because if you not revise it, some of these things you find difficult to understand. Incubation period means the period between the establishment of an infection and manifestation of symptoms. And in malaria, human malaria, it varies with the species of Plasmodium. For falciparum, averagely 12 days. For others, these are the figures. 14 for beavers, malaria 28, ovale 17. It is known, this is some of the information that are available in terms of pathogenesis. It is known that many times Plasmodium falciparum infection may terminate spontaneously in less than 1 year. Even if one way or the other the person is not treated, one way or the other, if there is no complications, and God, let me put it that way, taking control, the person may be delivered, may be healed, and the thing may be wiped off the, the bloodstream, one way or the other. But the remaining 3 species, those ones, they are a bit more troublesome. Why? Because they continue to multiply in the liver cells even long after initial bloodstream invasion. And when they are in the liver cell, they continue to multiply. And eventually, what happens? Even by the time such a person, people who are infected, by the time they are treated, for example, and if the medicine does only clear the one that is in the peripheral blood, as long as those that are in the liver cell still remain, there could be what we call relapse, because those ones will not come out. Those that are in the exoerythrocytic cycle will not come out, entering the bloodstream to establish to either reinforce or establish another erythrocytic cycle, particularly if the thing has disappeared before, to establish another cycle entirely. So that's what we see when you have relapse fever. So people do say in P fevers and P malaria and ovale infection, it's known that the parasitemia means the load of parasite in the blood, are relatively low grade. Why? Because the parasites invade either young or old red cells. Either young or old red cells. Notice I did not say either young people or old people. We are talking about cells, red cells, the erythrocytes. So these 3 species of Plasmodium, vivus, malaria, ovale, are somewhat discriminatory. They either go for the young red cells or the old ones. But in the case of P. falciparum, that's Plasmodium falciparum, they will invade all red cells of all ages. Notice I did not say red cells of all, what do you call it, people of different ages. No, that's not what I'm saying. Red cells of all ages in any given infected person, including the one that are to give rise to blood cells later, erythropoietic stem cells that are found in the bone marrow, for example. And because of that, the load of parasites in the blood is often very high. Parasitemia is high. In addition, Plasmodium falciparum cause the red cells that are parasitized to produce projecting knobs. You know, there are things like things that stick out of the cells, and then they adhere to the lining of the blood vessels, causing obstruction, blockage, thrombosis, blood clot in blood vessels, local ischemia, deficient blood supply. And it is understandable because there is obstruction, there's blood clot, so there will be deficient blood supply. Then it also causes, you know, fetal complications. These are all due to the red cells now producing knobs. Fetal complications include cerebral malaria, gastrointestinal disorders, you know, cold malaria. I remember when we were very young, you see some people manifesting, some children, so manifesting some things Yorubas call giri. Only God knows how many children were lost through that due to lack of knowledge. Now, in many cases, cerebral malaria as a complication of Plasmodium falciparum could manifest in infected children. And when we say cerebral malaria, it means that the what do you call it, the brain and some other related portions of the nervous system, you know, central nervous system, are already affected by the malaria parasite, you know, one way or the other, causing a lot of havoc, which makes the child concerned, you know, to behave as if it's under epileptic seizure. These are some of the things that could manifest due to this Plasmodium falciparum infection. So note this and learn. We continue. Periodic sudden attack are known to be related to events in the bloodstream. The first stage is that of chill, you know, it could last for 15 to 1 hour. At this point in time, when we say chill, the person will be feeling very cold. Nausea, vomiting, headache are common at this time. The second stage is febrile or feverish stage, lasting several hours and characterized by spiking, very high fever, very high and very significant, serious rise in temperature. The temperature of the infected person could be 40 degrees centigrade or even greater than that. And it is believed that at this time, you know, the parasites are invading new red cells. The third stage, which is the last one, is the sweating stage, when the person concerned, you know, feels a bit relieved, falls asleep, later wake up, you know, feeling as if everything is okay. But except there is miracle or the person is treated, the cycle will continue. And as this disease progresses, that's talking about, you know, malaria generally, talking about the sudden attack. As it increases, you know, in those who are infected when they are not treated or something miraculous happen, other clinical manifestations could occur, apart from those I've talked about before, particularly in the case of P. falciparum. Pneumocytic anemia. What does that mean? It is anemia, but it's not due to the fact that the red cells are sickled. They have normal shape, but because of the fact that many of them are destroyed, so there's still anemia. Splenomegaly, that's enlargement of the spleen. Hepatomegaly, enlargement of the liver. How do you diagnose human malaria? Microscopy, that's true. RDT, many of you, some of you had your IT in some places where you might have, where I don't know if any of you, where you have done such things. RDT, that's rapid diagnostic test. Then prevention and control. 1, prompt and effective diagnosis and treatment, very important. And when you want to do treatment, that's chemotherapy. You could have monotherapy. That used to be the style in those days several years ago. But now it is combination therapy. That's the common thing. Even this artemisinin-based drug, it has not only one type of what you call it drug. There are two that are combined. Combination therapy is often the order of the day. Chemoprophylaxis, that's using drug to prevent infection. That is what is often done to to pregnant people when they go to clinic, during prenatal, what do you call it, the clinic days before they give birth to the baby. Integrated vector control is also very important. Insecticides, use of insecticide including long-lasting insecticide net, biological control, larvivorous species and other things which you have here, physical control, mosquito spraying, environmental management and the like, health education and community participation. Then vaccination is also a very important tool. Now, the only approved vaccine as of 2015 is RTS, known by most queries, but that's the problem. It requires 4 injections and has a relatively low efficacy. But there's a more promising one now, known as R21/Matrix-M. This one has been found to meet and exceed the WHO's target of 75% efficacy. And trials have started, few trials, and they have been done. And very soon, one way or the other, you may have these available to be used for children, and then particularly to start with the pregnant ones. Now I go on to schistosomiasis. This one is very important. And remember your 200 level knowledge of biology of tropical parasites. You bring such things in now, like I told you earlier. Schistosomiasis is one of the major world health problems, and because 200 billion people in 74 countries, including Nigeria, are known to have been, estimated to be infected, with some 600 million at risk. And there are a number of species. Schistosoma mansoni, which is endemic throughout Africa and the Middle East. Hematobium, find it in Africa and the Middle East. Intercalator, also occurs in some African countries, including Nigeria. Japonicum and Mekonga, those ones are not found in Africa. They occur essentially only in Asia. How are they transmitted? How are these parasites transmitted? Or what are the factors that enhance them? What do you call it? What are the factors that give room for their transmission? Human contact with fresh water. The point is this: Even if a fresh water is having the Saccharine, I hope you remember Saccharine, of the parasite, as long as humans do not contact such a fresh water, there will be no transmission. Presence of a suitable snail species. If there are no suitable snail species in any given freshwater body to help to serve as intermediate host, then even if the eggs get to the water body, that will be their end. And then contamination of fresh water with human feces, that is urine and feces. If, as long as this continue, people poo-pooing, that is defecating or into what water bodies urinating, or one way or the other, the water their waste gets directly into water body, then you could have since all these things are together, working together, transmission of schistosomiasis, that is of the causative agents, taking place. Factors enhancing infection. That is what I think that predispose people to infection. We are talking about humans now. First, occupation. Some people, by virtue of their occupation, they are readily predisposed. Farming. Those who do farming, maybe on the way to their farm, to their farm, they have to fetch water on the way, to drink. Fishing in fresh water, that. Working in irrigation canals is another thing that also go alongside with occupation. These are examples of occupation that could enhance or predispose people to infection. Laundry, you know what laundry is, cloth washing, and some other domestic activities. Some people enjoy doing this in the freshwater body. I remember when we were in my hometown there, when there was water scarcity in the town, maybe the taps are dry, we'll carry many of our clothing to a stream to wash. We will even take a bath there and even fetch some water to go with for drinking or bathing. These are factors that could enhance schistosome infection. Another one which we have noticed via research is edible freshwater snail collection. A very good example of such snails is Lanistis. You are going to see that in the laboratory. I noticed that people, some particular young children, pursue Lanistis, and in the course of doing it, they are readily exposed to some infection. If there are no infections in such other bodies, fine, but you wouldn't know whether they are there or not. So, but when children or elderly ones pursue edible freshwater snails, for consumption, they are exposed to what we call the schistosome infection. Now, it has been found that if there could be presence of piped water and then you have functional pit latrines or toilets generally, the risk of infection can be reduced. Now, before we talk about control generally, what is the situation with this disease and mortality, particularly, vis-a-vis the two main ones? Generally, it is known that the higher the intensity, the higher will be the morbidity. That has been particularly in children. So remember, it is very important. You note that there is this relationship between intensity of infection and high morbidity, particularly in children. That is for both schistosomiasis due to hematobium and even Mansonia. Now, specifically, some things about what we call infection with S. hematobium. S means schistosoma. Again, it is known that in 50 to 70% of infected people, Symptoms such as hematuria, dysuria, proteinuria manifest. Hematuria means presence of blood in the urine. Dysuria, difficulty in urinating. Proteinuria, presence of protein in the urine. In the early stage, the parasite may cause urinary tract disease, such as urothelial ulceration and bladder polyposis. You may need to know much of this, just urothelial ulceration has to do with ulceration of some some vessels which are associated with the urinary system. You know what bladder is. Polyposis, I've tried to decode here for you. In chronic disease stage, you could have ureteric, it has to do with urethra, and bladder fibrosis. Likewise, calcification is also a common thing. Again, try to check the meaning of each of these words. As you are students, you should be very inquisitive. For S. Marsona infection, the symptoms could include abdominal pain, bloody diarrhea, and fatigue. In chronic cases, there could be intestinal problem, intestinal involvement, including colonic polyposis, focal fibrosis, this is what fibrosis means, and inflammation. The spleen, the liver could be involved, hepatosplenic. The liver and the spleen could be involved, causing, in which case you have, then when I was trying to tell you, when in the case of hepatosplenic, remember, hepatic has to do with liver, splenic has to do with spleen, and when they are when they are involved, you could have hepatic fibrosis, portal hypertension, and these are known to be at times life-threatening and even irreversible when they are in advanced stage. Hepatomegaly, that is enlargement of the liver, is another thing that has been known to occur or common in endemic regions. Generally, schistosomiasis has negative impact on the nutritional status, growth, and fitness of patients. Mortality due to schistosomiasis has been underestimated due to poor documentation, and still, according to WHO, the daily loss for women is estimated to be, schistosomiasis is estimated to be 4.5 million. How do you diagnose? Yes, for S. hematobium, you examine the urine. There are different ways, methods that could be used. Then reagent strip can be used to examine the urine for hematuria. For those other species, Marsona and the like, fecal examination. But let me tell you at this point in time, there are times you could have X of hematobium, a fecal sample, and X of Marsona in urine. How do you differentiate? The morphology of the X. Very important. Other diagnostic methods, ultrasound, liver biopsy, serodiagnosis. How to prevent and control schistosomiasis? Snail control through weeding, mollusciciding. Weeding in the sense that snails in fresh water cannot survive if there are no weeds for them to attach on and then to feed on. So if you clear them, fresh waters of weeds, you are controlling snail. Another way is to do mollusciciding using a kind of killer, snail killer, let me put it that way. You know, when used carefully, can help to control snail in water bodies. Provision of functional toilet facilities. I've emphasized that the other time. Treatment of infected humans. The drug of choice is praziquantel. Provision of adequate potable water, so that people could have water to drink for bathing and the like. Then provision of public swimming pools. This is important because some people, they love, you know, cooling off in water bodies, freshwater bodies. So if they are provided with public swimming pools and they are kind of hindered from having access or discouraged from going to natural water bodies to swim, that could be could help a long way in controlling schistosomiasis. Education and enlightenment is very important. And then when there are laws, enactment of sanitary laws is important. They are enforced. Enactment and enforcement of sanitary laws, very, very important.